Hi, I'm Rachel. I'm a grandma and a mother. When I was 18, I was diagnosed with schizophrenia. I would spend months in the hospital, and it just went on for years. I noticed it first in my hands, and then I started getting very upset when it started going to my face because people were not very kind. At that point, my hands were like this all day. My tongue just kept sticking out of my mouth, I lost the feeling in my legs. My legs wouldn't hold my body anymore. And it just got so bad. For the longest time, I didn't want to go outside. I was too ashamed to go outside. I was too ashamed to go and talk to people and be around people because of the movements. They were so embarrassing. That really hurt my feelings was the cruelness people had towards me with making fun of me. Why are you talking like that? You sound drunk. Why is your tongue sticking out? Why are you walking like that? I went to the doctor and I pleaded with her. I told her, please listen to me. Something's going on with me. When I was diagnosed with the tardive dyskinesia, it finally gave a name to something that I didn't know. When I started taking the AUSTEDO, my hands started smoothing out where they weren't tapping so much. And then I noticed that my tongue started to stay in my mouth more. The AUSTEDO lessened my movements so much that I was just stunned and I couldn't believe it. With less TD movements, I'm able to do more things now. I can make bracelets with my beadwork. I can do my woodwork. I can go and play with the kids. I can go for walks now. I can hold my own cup. I can brush my teeth. I can clean the house. I can drive again. It's important to know about my story because there's so many people out there that have it and they're ashamed. TD is not your fault. You can do something about it like I did. You can ask your doctor for medication. It just took everything and turned it around and made me be able to be alongside of people again. It made me feel that there's hope.
AUSTEDO XR and AUSTEDO are indicated in adults for the treatment of chorea associated with Huntington's disease and for the treatment of tardive dyskinesia. AUSTEDO XR and AUSTEDO can increase the risk of depression and suicidal thoughts and behavior, suicidality, in patients with Huntington's disease. Balance the risks of depression and suicidality with the clinical need for treatment of chorea. Closely monitor patients for the emergence or worsening of depression, suicidality, or unusual changes in behavior. Inform patients, their caregivers, and families of the risk of depression and suicidality, and instruct them to report behaviors of concern promptly to the treating physician. Exercise caution when treating patients with a history of depression or prior suicide attempts or ideation. AUSTEDO XR and AUSTEDO are contraindicated in patients who are suicidal and in patients with untreated or inadequately treated depression. AUSTEDO XR and AUSTEDO are contraindicated in patients with Huntington's disease who are suicidal or have untreated or inadequately treated depression. AUSTEDO XR and AUSTEDO are also contraindicated in patients with hepatic impairment, patients taking reserpine, or within 20 days of discontinuing reserpine, patients taking monoamine oxidase inhibitors, MAOIs, or within 14 days of discontinuing MAOI therapy, and patients taking tetrabenazine or valbenazine. Clinical worsening and adverse events in patients with Huntington's disease. AUSTEDO XR and AUSTEDO may cause a worsening in mood, cognition, rigidity, and functional capacity. Prescribers should periodically reevaluate the need for AUSTEDO XR or AUSTEDO in their patients by assessing the effect on chorea and possible adverse effects. AUSTEDO XR and AUSTEDO may prolong the QT interval, but the degree of QT prolongation is not clinically significant when AUSTEDO XR or AUSTEDO is administered within the recommended dosage range. AUSTEDO XR and AUSTEDO should be avoided in patients with congenital long QT syndrome and in patients with a history of cardiac arrhythmias. Neuroleptic malignant syndrome, NMS, a potentially fatal symptom complex reported in association with drugs that reduce dopaminergic transmission, has been observed in patients receiving tetrabenazine. The risk may be increased by concomitant use of dopamine antagonists or antipsychotics. The management of NMS should include immediate discontinuation of AUSTEDO XR and AUSTEDO, intensive symptomatic treatment and medical monitoring, and treatment of any concomitant serious medical problems. AUSTEDO XR and AUSTEDO may increase the risk of akathisia, agitation, and restlessness. The risk of akathisia may be increased by concomitant use of dopamine antagonists or antipsychotics. If a patient develops akathisia, the AUSTEDO XR or AUSTEDO dose should be reduced. Some patients may require discontinuation of therapy. AUSTEDO XR and AUSTEDO may cause Parkinsonism in patients with Huntington's disease or tardive dyskinesia. Parkinsonism has also been observed with other VMAT2 inhibitors. The risk of Parkinsonism may be increased by concomitant use of dopamine antagonists or antipsychotics. If a patient develops Parkinsonism, the AUSTEDO XR or AUSTEDO dose should be reduced. Some patients may require discontinuation of therapy. Sedation is a common dose-limiting adverse reaction of AUSTEDO XR and AUSTEDO. Patients should not perform activities requiring mental alertness, such as operating a motor vehicle or hazardous machinery, until they are on a maintenance dose of AUSTEDO XR or AUSTEDO and know how the drug affects them. Concomitant use of alcohol or other sedating drugs may have additive effects and worsen sedation and somnolence. Tetrabenazine elevates serum prolactin concentrations in humans. If there is a clinical suspicion of symptomatic hyperprolactinemia, appropriate laboratory testing should be done and consideration should be given to discontinuation of AUSTEDO XR and AUSTEDO. Deutetrabenazine or its metabolites bind to melanin-containing tissues and could accumulate in these tissues over time. Prescribers should be aware of the possibility of long-term ophthalmologic effects. The most common adverse reactions for AUSTEDO, greater than 8% and greater than placebo, in a controlled clinical study in patients with Huntington's disease were somnolence, diarrhea, dry mouth, and fatigue. The most common adverse reactions for AUSTEDO, 4% and greater than placebo, in controlled clinical studies in patients with tardive dyskinesia, were nasopharyngitis and insomnia. Adverse reactions with AUSTEDO XR extended-release tablets are expected to be similar to AUSTEDO tablets. Please see full prescribing information, including box warning, at austedohcp.com.